Welcome to Barbados Fertility Centre's Clexane injection instructions. My name is Anna Hosford and I'm here to walk you through this step by step. So, if you are on the immune regime, you will be on a low dose of Clexane or heparin. Let's go through the Clexane. So, the Clexane is pretty easy. It's 40 milligram injection. It's done once a day, every 24 hours. So you're going to pick a time that suits you. It can be morning, it can be evening. It doesn't matter to us as long as once you pick a time, you keep it at that time every day. It is important that this medication is time specific. So if you decide to do it at 8 p.m. at night, you need to do it as close as that time every day as you can. Inside each box is 2 injections. You will be using 1 per day. It's already pre-filled and all ready to go. You pull back your plastic seal and you take your needle out. Inside the needle, there is a plastic cap. You just pull it off. It's all ready to go. You don't need to mix it. You don't need to get rid of air. You don't need to do anything. It's just literally pull off the cap and inject it. When you pull off the cap, to do the injection, the Clexane injection is done in your tummy. You want to stay away from your belly button, stay away from your belt line, and you're going to alternate this injection because you do not want to go into an already bruised area. One of the functions of Clexane is to thin your blood ever so slightly. And so with each injection, you might get a little bruise. So do not go into that bruised area. Stay about an inch apart. Starting over here, Monday, Tuesday, Wednesday, Thursday, moving around. You can go right out from one side to the other, pinching a little bit of fatty tissue, injecting it in. When you inject in the medication, you pull your needle out. The most important thing with the Clexane is that you don't rub or massage it after the injection. You just wipe with your alcohol pad. And of course, if you want to ice before and afterwards, it really helps reduce the bruising. But don't massage the area after the Clexane or heparin injections. Don't be afraid if you see a bit of bruising. That's okay, it's normal. Just move along. Each day doing a different one as instructed by your nurse. If you are not on the Clexane and instead your pharmacist has dispensed heparin, the heparin is also for blood thinning and the heparin is also done in your tummy. The difference is the heparin is done twice a day. Please be sure to tell your nurse coordinator whether the pharmacist gave you the Clexane or the heparin. The nurse will tell you then what dose of heparin to take. The same with the Clexane. The heparin is time specific, so if you're doing it twice a day, you do need to keep it as close as possible to that time. 6 a.m. and 6 p.m., 8 a.m. and 8 p.m., 12 midday to 12 midnight. We don't mind as long as the 2 injections are done every day, 12 hours apart. Good luck.